Hey students, my name is Ronald Peacock. I'm here to give you a public service announcement on eating disorders. What we're going to talk about today is understanding eating disorders, why it's important, um, and so let's jump right into it. So I'm going to start with kind of what I think every student should know when it comes to eating disorders. First thing is the seriousness, right? So an eating disorder is actually a serious mental health condition that affects millions of people worldwide. It can begin in adolescence or young adulthood, or honestly at any point in time. But as we're discussing this with students, I wanted to point out that this is kind of the time when these things can develop, and so it's important to have an understanding. And again, despite how common they are, which I'm sure most of you have heard about eating disorders, they can still be very misunderstood and overlooked. So I want to break down two of the major eating disorders. I'm going to explain how common they are, and then I'm going to talk to you a little bit about treatment options for those of you who may be struggling and how to get back to a path of good health. So let's jump right in. The first one I'm going to talk about is anorexia nervosa. So anorexia nervosa is actually an eating disorders where individuals will severely restrict the food that they intake. This is often noticed by severe weight loss or noticing someone who is extremely low in body weight. According to the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, the key features of anorexia nervosa include an intense fear of gaining weight or becoming fat, a distorted body image. So, the way that you see yourself, either overweight or underweight, is often something that is very taxing. You could be 100 pounds looking in the mirror thinking that you're still extremely overweight, which further attests to the mental disorder involved. And then also significantly low body weight due to restricted eating. So it can often be noticed too with how you're eating, what you're eating, and how often you're eating. Um, Other common things are people with anorexia nervosa may either exercise excessively, skip meals, or also follow extremely rigid diets, which may not be healthy. Also, it's not just about the food with this disorder. It's often tied to deeper emotional struggles, either around control, self worth, or anxiety. So, I know an example from some of the things that I've heard is that, those who feel that there is no control in their life, being able to control their food intake is often something that gives them that sense of control. Self-worth and anxiety, you can have anxiety around your body image, your weight, and this can be so severe that it leads you down the path of becoming anorexic. The next one I'm going to talk about is bulimia nervosa. So bulimia is actually involves a cycle of binge eating. So what binge eating is eating a large amount of food in a short amount of time. This can follow, certain other behaviors like vomiting, using laxatives, or fasting to kind of undo what you've done. So essentially, you are in this moment of feeling the need to just overeat. So let's say you went to the Jack in the Box, you ordered everything on the menu, you ate it all in one sitting. Now you begin to feel, guilty. And so you use unhealthy behaviors like vomiting it up, using laxatives to push it through the body, or excessive exercise. So further categories that fall into that would be repeated episodes of binge eating, a sense of loss of control during the binge, engaging in unhealthy behaviors to prevent the weight gain, self-evaluation that's overly influenced by body shape and weight. So again, similar to anorexia, it's similar to a body image issue, and it's just another way of um, how the disorder can affect you. So you've probably all heard of binging and purging, overeating, and then throwing up afterwards, and then all the negative effects that come with that. However, unlike anorexia, individuals with bulimia, they can often maintain a normal weight, making it harder to recognize the disorder. Because again, if you're eating normal, but then you have episodes of binging and purging, oftentimes that doesn't necessarily fluctuate with your overall weight. But the signs and symptoms can be seen, again, with the vomiting, the effects that vomiting can have on your teeth, and the effects that overall binging and eating has on your internal organs. So the prevalence and risks, I wanted to touch on these with you guys. So about 1% of women in the US will experience anorexia in their lifetime, and about 1.5% will experience bulimia. And these numbers may be underreported again due to the stigma and secrecy of the disorder. It's often, kind of considered a topic that people don't want to talk about. And so it is said that it may be very widely underreported. And then binge eating disorder, which is another common diagnosis, affects around 3.5% of women and 2% of men. So based off those statistics, binge eating is a little more prevalent than anorexia, but again, it's hard to tell because we don't know about underreporting or overreporting. Again, I touched on it a little bit, but the consequences of these diseases on your health can be severe. We're talking about heart disease, bone disease, digestive problems, and in some cases, even death. As you've seen or heard, you can starve yourself to death. It can cause electrolyte imbalances. I mentioned before, tooth erosion, gastrointestinal issues, common in bulimia, with the vomiting. And then the emotional and social impacts that, include anxiety, depression, isolation, low self-esteem, difficult maintaining relationships or school performance, which is important and why I wanted to touch on this with you guys as you're all students. So what do we do? How do we help? Luckily, there are some treatment options. And like most mental health disorders, treatment options, early intervention is key. So the sooner we can get someone help, the better the outcome. Some of the evidence-based treatments that are known to work are cognitive behavioral therapy is one. This is one of the most effective treatments for bulimia and binge eating disorder, as it helps individuals kind of understand the thoughts and behaviors that lead to what's going on. There's nutritional counseling, which this often includes dietitians, and it helps work with individuals to build a balanced relationship with food, teach proper nutrition, and paired with therapy, this can often be a good result for those with anorexia. And in severe cases, there's inpatient and residential care programs that can provide support. You can, similar to like a substance abuse rehab, you can go be in a safe place for, up to 30, 60, 90 days and really get back to the basics. So I want to leave you with kind of my final thoughts. Again, I know this is a controversial topic and it's tough to talk about, but as we mentioned before, early intervention is the key. Eating disorders are serious health problems, but they are treatable. So if you know somebody who's struggling, if you're struggling, please don't wait to reach out. Whether it's an adult, school counselor, mental health professional, please let somebody know. Intervention is there, recovery is possible, and nobody has to go through this type of thing alone. So with that, thank you for listening, and I hope you guys have a great rest of your day.